Did you see blind and partially sighted persons? The right to accessible healthcare. This is a message for all politicians, decision makers in healthcare, and journalists. What have you done to make healthcare accessible for blind and partially sighted persons? We need you to make sure this right is upheld. The human right to accessible healthcare for blind and partially sighted people is covered in Sustainable Development Goal 3 and Article 25 in the United Nations Convention on the Rights of Persons with Disabilities. This right is important, especially in times of extraordinary health situations such as pandemics. It covers the rights for blind and partially sighted people to have access to the same free or affordable healthcare services as others. Get the healthcare services they need because of their disability. Have services near to where they live, even in rural areas. Have the same level of access to communication and information in preferred formats, like Braille, large print and electronic, accessible for screen readers. Receive the same advice as others from health professionals. Not be discriminated in health and life insurance. Not be refused care or treatment because they are blind or partially sighted. Have the right for preservation of residual sight when possible. Provision of screening services to prevent further sight loss. Unfortunately, access to healthcare and services for blind and partially sighted people is far from the level of access of others. How to make this change? Raise awareness of the needs of blind and partially sighted people for accessible healthcare, such as by sharing this video. Ask politicians and healthcare decision makers about their plans to make healthcare accessible for blind and partially sighted people. Work with representatives of the local or national blind and partially sighted community. For more information, contact EBU, the European Blind Union at euroblind.org. This video has been supported by the Rights, Equality and Citizenship Programme of the European Union.